Welcome to scholars joining us, both those joining us in our Zoom studio and those who are watching online. Do let us know you're here. Send a comment. Let us know what city and country you're from. Today, we have a very interesting topic. We'll be discussing with Dr. Francine Ganter-Restrepo from the World Health Organization, and Charlotte is going to tell us what we'll be talking about. We're 3 minutes away from starting, so you're not late. We just want to help you get ready for this session. Charlotte, what is today's topic?
So thank you very much, Reda, and hi everyone. Today we'll be talking on people-centered immunization services.
All right, great. So we are now 2 minutes away from the start. We'll be right back. Just hold on and let us know in the comments how you're doing and where you're connecting from. A warm welcome to you. I am Reda Sadki from the Geneva Learning Foundation. We are here, of course, to talk about Immunization Agenda 2030, the world strategy for this decade to achieve the immunization goals. With me, we have our guest, Francine Ganter-Restrepo from the World Health Organization, and Charlotte is going to introduce the topic and kick off with the questions. We're looking, of course, to your questions, both scholars who are with us in our Zoom studio and on the various social media platforms. Charlotte, how are you doing? And what is your first question to our guest?
Thank you very much, Reda, and welcome everyone. Welcome, Francine. So we'll be talking today on people-centered immunization services. So, Francine, please, can you tell us who you are, where you work, and what you do?
Yes, thank you for having me. My name is Francine Ganter-Restrepo, and I work at the World Health Organization headquarters in Geneva. I work within the Demand and Behavioral Sciences team as part of the EPI unit. My background is in medical anthropology as well as user experience research and human-centered design. So a lot of the work I do here is thinking about service experience for immunization and how we can increase demand and ultimately uptake of vaccines through good service experiences.
Okay, thank you, Francine. So what can you tell us, what are people-centered services?
Yes, excellent question. People-centered care in general is where health and care professionals work collaboratively with the people who use those health services and the communities in which the individuals and the services are situated. So that means that care has to be coordinated, it needs to be tailored to individuals, and it should be underpinned by dignity, compassion, and respect to enable people to live a fulfilling life and ultimately benefit maximally from the health services. So to summarize, people-centered is really a lens that we apply in the design, delivery, and management of health services to ensure that they're well suited to the needs and preferences of individuals in a given setting.
Why are they crucial for the implementation of Immunization Agenda 2030?
Yes, so this is quite an important concept, and it doesn't apply to health alone. But we know that people are unlikely to use health services if they don't feel treated with value and respect, and that's even where services can be nominally accessible. And this isn't surprising, and it's, as I said, it's true for more than just health. You know, if you have a bad experience somewhere, that impacts your motivation, your willingness to go back to that place, that person, or that situation. That's why it's so critical for achieving primary healthcare and universal healthcare, integration, coverage, and equity, and commitment and demand, all the strategic priorities of IA2030. As we have learned this last year, it's also crucial to work with people and communities to tailor services in the context of outbreaks and emergencies, and through research and innovation as well, to ensure that we're still providing that critical care and immunization to individuals that they need while keeping communities safe. We've also learned how supply and logistics is a critical component of people-centered care. If the resources are not there, or there's not enough of them, they're not delivered in a timely fashion, that ultimately inhibits healthcare workers' ability to deliver quality services, people-centered services, and in turn impacts the experiences that individuals have with immunization or even with the health system at large, and that results in missed children, so unvaccinated or undervaccinated children. So to emphasize what I'd already said a moment ago, people-centered is really a lens that we apply to the design, delivery, and management of health services to ensure that they're ultimately meeting the needs and expectations, preferences of individuals in a given setting. And this can have lasting benefits. There's evidence that it improves health outcomes, where people are more engaged and they take more ownership in health. It can improve quality of care and patient experiences, but there are also proven benefits for the health workers. As I said, if we can enable them to deliver better care, more meaningful care, that ultimately will enhance their satisfaction with work as well. So that's why, to summarize, it's so critical for IA2030 and achieving the strategic principles.
Thank you, Charlotte. Thank you, Francine. We just want to mark a pause to explain we're discussing ahead of the WHO Scholar Level 1 certification on Immunization Agenda 2030. We're discussing people-centered services, and this is part of a series of lightning chats. So we're going to go very quickly. We have a few questions, but this is about your questions. So right now, especially if you're in our Zoom studio, get ready. We're going to turn to you to hear what questions you have about people-centered services, what you want to know. Francine is here for that, you may leave hungry for more, and that is actually what we're hoping. We'll be sharing some of the resources that you can use to find the tools, to find the knowledge that you need around this topic of people-centered services. So back to you, Charlotte. What is your next question for Francine?
Yeah, my next question for you, Francine, was going to be what are the key elements we need in place to offer people-centered services experience? I think you started answering that, but can you add some more information concerning this?
Yes, absolutely. So again, it's not just thinking about the delivery, it's also the design and management of those services to ensure, a good continuity and careful planning. And this should be shaped by and responsive to the needs of individuals and communities. It should include addressing barriers to access to immunization services, due to things like age, location, social and cultural norms, or even gender-related factors. So a really key element to delivering people-centered services is to take a holistic view of that individual and not consider them in the clinical context alone, not to just consider their, care, their clinical care needs, but also their needs outside of that context. We need to keep in mind everything that leads up to the point of interaction at the health facility for immunization, but also for all health services, everything that enables them to get there, to be there, and then and receive life-saving vaccines. But also everything that must happen after immunization or any interaction with the health service to ensure that they come back, to ensure that they have the information they need, and whatever else they might need to come back for a follow-up appointment. So to be really concrete about it, in practice, and if we have any health workers with us in the audience, in practice this means listening to patients, to understand what a person says and try to act on that, to get to know a person beyond their clinical needs, their problem or a diagnosis or the vaccine they need that day. To make decisions with people, with their families and other important others in their lives to resolve their particular challenges, to notice and pay attention to things and just acknowledge patient needs with empathy, so that you show that it's not just about giving vaccine, but it's really about wanting to improve health outcomes more generally and quality of care and well-being. So it's really listening and being empathetic and trying to take that on in your interactions and act on that in the way that you deliver care.
Thank you, Francine. So what approaches or tools can support strategic implementation of people-centered services?
Absolutely. There are a range of excellent tools out there and available today, such as the WHO tailoring immunization programs that supports a kind of strategic approach for designing tailored and people-centered services. There's also the UNICEF HCD for health, that's human-centered design for health, and we're working on a sort of a wrapper for both of those things, because ultimately they encourage a very similar approach, which is to involve communities in the dialogue, to involve them in the planning for the design, delivery, and management of health services, to make sure that we're really incorporating their needs. There are also other tools such as quality improvement efforts, the REDQI, so reaching every district quality improvement, MOV assessments also fall under a tool that you could use for more people-centered, for delivering more people-centered care. And then just very broadly to say that a great approach is to establish feedback loops, whereby we not only collect feedback from communities on how services are performing, and this is something that can be done through, for example, community scorecards, but we also communicate back to the communities how that feedback is being acted on, how we're using that feedback to make decisions about how we design, deliver, and manage immunization services, so that they really feel that they have a stake in those services and that their voice is having an impact. And it's so important. Community ownership is so important. And again, this is not just with health. We see this in many parts of life, that if you feel you don't have an active stake in something, if you don't have ownership, you don't have a voice, you're less likely to engage with that, and less likely to want to support positively in improving the quality and outcomes of those services. So another tool that will be WHO will be releasing in hopefully the coming weeks is a quality immunization planning guide, which provides checklists of different actions that health systems and health facilities and even community-based workers can take to ensure quality of immunization services, which includes ensuring that they are people-centered, that they're meeting the needs and expectations of people in those communities. So do watch out for that. As I said, hopefully in the next weeks, we'll get that up online so people can engage with that and use that.
Okay, thank you very much, Francine. And I have since over a year now, the world has been facing a major pandemic, the COVID-19 pandemic. How has that impacted implementation of people-centered services and approaches?
That's a really great question. And we've seen around the world programs grappling with this challenge of how to redesign their services for this context. And in some cases, we've seen some absolutely fantastic examples of how we've managed to deliver immunization in a way that still safeguards the communities, the mothers, and the children coming in. So we've seen in places like India and Bangladesh how we've used structural nudges. So, for example, seen people draw circles on the ground in health facilities to ensure that parents and children are always keeping a safe physical distance and still able to go to the health facility for the care that they need, for the immunization that they need, without being overexposed to any danger of COVID transmission. We've also seen in places like Brazil and in many other countries the rise of drive-through vaccination. So vaccination campaigns where vaccines are delivered to you in your car. So that's another great example of using a human-centered design to tailor services to meet the needs of people, so that people can come in and get the vaccines they need while not compromising their safety. So it's been an interesting year to see how immunization programs around the world are grappling with this challenge of how do we continue to deliver services in these challenging times. And it's been a year of just really exciting innovation and creativity from those programs to be able to meet that need and ensure that that parents are still able to take their kids in for vaccination, and that we're not leaving anyone behind with that.
All right. Over to you, Reda. I'm sure we have a first question from our audience.
Yes, indeed. So let's look at what is happening in the chat right now as well as online. So we have mostly greetings. Greetings from Atahir Abubakar from Nigeria, Ismail Edego from Nigeria as well, who says it's good to be here again. And indeed, this is part of a series of what we call lightning chats. In 15 minutes, you get answers to basic questions, and then we also tell you where you can go to learn more. David Nasanga is connecting from Brussels, and then we have Francophones who are also connecting from Facebook in the DRC, Tamwasi and Kashama, and Francis Deasal. Now, with respect to the questions, we have Chris, who says the success of people-centered depends largely on data. What is WHO going to do specifically to assist developing country providers to identify, collect, and process data for evidence-based decision-making in healthcare service delivery? Let's see if we can unmute Chris. I see there are two Chris's. Let's go to, yes, I believe asking you to unmute. Would love to hear you. Could you introduce yourself and share with us what's the context for your question? Tell us more.
Okay, thank you very much. Chris speaking here. I'm a developing country immunization expert, worked in Nigeria and some other African countries before. The issue is data-driven decision-making in healthcare services. Now, the issue of data provision, data identification and management in Africa is very, very, very slow because of penetration of internet and other services. So is WHO going to assist healthcare service providers, as least decision makers in developing countries, to be able to identify, develop, and manage this data so as to be able to use it to decide how to provide healthcare services, especially immunization, especially during this COVID-19 vaccination? We need more information to help us to decide and assist in the services delivery that we have overcome, that we're carrying out right now in developing countries. What is WHO going to do specifically to assist us in data collection and management so that we can make evidence-based decisions in our service deliveries?
Absolutely. So a key issue that is very much on our agenda here at WHO. As I mentioned, we're soon to be releasing a quality immunization service planning guide, which includes within it approaches and specific data gathering and use considerations in settings where there is minimal infrastructure for this. And so what are the kind of easy to apply methods that give you just enough data? And I mentioned, for example, establishing feedback loops, and we've seen many great examples in places like Ethiopia where communities are actively involved in micro-planning. They're the ultimate experts of their own needs, and so acknowledging that and doing that. Separate to that, you may be aware that WHO has been engaged in a longer-standing effort to develop tools that measure the behavioral and social drivers of immunization. So this is a set of tools that includes quantitative surveys and qualitative interview guides for both childhood immunization and COVID-19 vaccines, and working at assessing the behavioral and social drivers of HPV in the near future as well. And the intent behind the development of these tools is really to suggest a really small and focused set of core indicators, 4 or 5, that really get at the underlying issues for why we don't see the coverage and uptake that we would like to see. And that's being designed in a way that's modular, so it can be easily integrated with other and already existing immunization activities, such as a coverage survey, so that it's light and inexpensive for countries to implement. And along with that, we're really considering options for how we can support that assessment, how we can provide the resources to countries to really be able to carry those out and use that data, including sort of auto analysis of that and technical assistance and capacity building around these areas, so that it just becomes part of the fabric of the way that we work, and it becomes integrated and triangulated with other really important immunization information, such as supply and logistics, as I mentioned. You know, another really key component to delivering people-centered care. I hope that's answered your question. There's a range of things that we are doing to support countries to be able to gather and use the data they need to apply that in the design, delivery, and management of people-centered services.
Great, thank you, Francine. It's actually Charlotte who has the next question for you.
I think since we have 2 more questions in the chat, Reda, I'll push my question to the end, so that we'll take a question here from Omar Sise, who says, hi Francine, vaccine hesitancy is one of the major challenges that is affecting immunization coverage in our region. Since the coming of the COVID-19 vaccine, the coverage of HPV vaccination at schools has drastically dropped. What do you suggest the way forward for them in this situation?
I mean, similar to what we were just saying, this requires a little investigation as to why it has dropped, and that's a kind of listening and understanding piece of the people-centered approach. Is before you think about what we're going to do, you have to really understand what is the underlying issue here. So I would suggest to start with that, to start with engaging that population, engaging the schools, the parents, and understanding what is the underlying barrier there, and really asking them what is it that we can do to support you to accept these vaccines.
Okay, thank you, Francine. We have another question from Wamba Gaston. He says, people-centered care services is a nice concept that, if used correctly, will help take care of the person as a whole, not only his or her problems. For this to work well, health personnel need to be enlightened. Are there training tools that may be used for this? If so, some links may be helpful.
Absolutely, that is such a key component, and we hear that so much from health workers, that they're under more and more pressure to provide that kind of holistic care, especially in an age where we see that people have a lot of questions about immunization. That they have a lot of questions about the benefits of vaccines, the need for them, the safety. And in many situations, health workers don't feel well prepared to be having these conversations. In some settings, they're even basically having to mediate in households where there might be differing opinions about the need for vaccination, and that's really tough for people who haven't been trained in that. The good news is that there are many tools out there for that as well. UNICEF has an interpersonal communications guide. I can drop that link in the chat, and I would say that is the go-to resource for supporting health workers to have these conversations, supporting their capacity building and training needs. There are also a range of resources in the Demand Hub. It's a partner coordination mechanism for immunization demand. specifically under the service experience workstream. So I'll be sure that those links get disseminated as well, so that you can benefit from those.
Wonderful. Thank you so much, Francine. And Charlotte, we have one last room for one last question. We go to 15 minutes. If there are crickets in the room, then we stop there. But obviously that's not the case today. So let's hear from Chris, another Chris Tamal. Welcome, and we'd love to hear from you.
Thank you very much for the opportunity. Speaking from Ghana. So my question is actually on immunization coverage. So there are occasions where managers may expect some targets to be achieved by the implementers. Meanwhile, maybe there are the resources in terms of the persons who are supposed to deliver those targets are not enough, or even the distances to cover to get those results are not enough. But at the end of the day, if you produce lower coverages, they more or less chastise you. So in order to meet the target, implementers might give data that does not resonate on the ground. So what is the role of the WHO in ensuring that we just suppose this kind of resource availability against the targets that we set for our implementers on the ground?
Thank you for that. My sound was a little crackly at the end there, but I think that you're getting at, again, the sort of the pressures on health services and the difficulties that vaccinators face in delivering immunization to the target population when there are logistical challenges in the way, and that's such an important part of people-centered services, and maintaining confidence and demand in immunization programs. We cannot give vaccines if those logistical parts, the supply parts, are not in place. If people, if health workers don't have the resources they need to be able to deliver that, then it simply doesn't get done, and that's such a critical element there as well. So in looking at the data, and informing the design and delivery of services, that's a really critical component. WHO is a strong advocate for making sure that there are the resources necessary to be able to deliver those services, and that there is strong political and even financial commitment to the immunization programs to be able to support those growing needs, and to be able to deliver vaccine under increasingly challenging situations.
Thank you very much indeed, Francine Ganter-Restrepo from the World Health Organization. The one place you can go following this lightning chat if you want to know more, good starting point, your new home, if you're interested in the Immunization Agenda, you can see right here. This is the Immunization Agenda 2030.org website. And of course, we'll be posting all these links both for course participants, but also on our social media platforms. You'll find the links in the comments. If you're on Facebook, you will receive all the resources, all the links that Francine mentioned. That's it for this session. We'll be announcing additional lightning chats. We have many more topics, really key topics that are part of Immunization Agenda 2030. And this is an opportunity to be the first in your country to learn about how these different pieces, interlocking pieces, fit together into the world's new global strategy to leave no one behind. Thank you so much, and see you soon.